Thank you so much, Sarah, and members of the IVSA, for inviting me to join you as we celebrate the second International One Health Day. My name is Joann Lindenmayer, and I'm the chair of the Board of Directors of the One Health Commission, an international nonprofit organization dedicated to advancing the understanding and application of One Health for the benefit of animals, humans, and the environment. I note from your website that the mission of the IVSA is completely consistent with the mission of the One Health Commission, that is, to benefit the animals and people of the world. And furthermore, within the IVSA, the One Health and Veterinary Public Health Committees focuses on promoting the importance of One Health and interdisciplinary collaboration between veterinarians and other public health-related scientists. Another similarity between our organizations is that both the IVSA and the One Health Commission share a global footprint. Today I hope to explain why veterinary medicine is so important to One Health, define the One Health concept and approach, and relate some of the work of the One Health Commission. But before I begin, I'd like to share my introduction to One Health. As a fourth-year veterinary medical student, I had the opportunity to travel to Niger. And as you probably know from recent news reports, Niger is a very poor country. About half of it is covered by the Sahara Desert, and another 30%, also known as the Sahel, is covered for much of the year by grasses that nomadic peoples use to maintain herds of cattle, sheep, goats, and camels. In 1984, Niger experienced a terrible drought that greatly reduced the nutritional quality of the grasses that livestock fed on. As a consequence, these animals became night blind due to hypovitaminosis A, which further reduced their ability to feed even upon grasses of poor nutritional content. Our team's purpose was to supplement the animals with vitamin A with the hope that they might survive the drought. We also hoped by supplementing the animals that we might stave off the effects of hypovitaminosis A in people who depended entirely on their animals for meat and milk. Sadly, in 1985, it was too late for most animals, and they either died or they were taken south and sold for a pittance in southern markets. People who depended on these animals for their livelihoods suffered greatly and flocked to the towns and cities where many were forced to beg to survive. This experience focused my understanding on the absolute dependence of people and animals on their environments in a way that no trip to the local supermarket in Massachusetts had ever done. I did not have a name for this at the time, but I have since learned to recognize it as One Health. Many other complex and global health challenges that we recognize today are subsumed under One Health. These may be seen in these photographs of a person suffering from MRSA, people and livestock in the middle of a flood, the burial of Ebola victims in West Africa, air pollution in Beijing, the waste that clogs our oceans and harms our wildlife, and in the often unchecked use of our environment by agriculture, timber, and mining concerns that leave small ecosystem islands where biodiversity is threatened. And of course, there is the grand One Health challenge that threatens to overcome humanity itself, the emergence and reemergence of diseases that potentially threaten our very existence. Dr. Kate Jones and her colleagues investigated all emerging infectious disease events, outbreaks, for our purposes, from 1940 through 2004, and concluded that the proportion of events attributable to zoonoses, particularly those of viral origin, was increasing, and for most of these the origin was wildlife. And while we should be rightly concerned about emerging zoonosis, let us not forget that the zoonosis that causes the greatest number of deaths each year, especially in children, is rabies, and it is nearly 100% fatal. The people most affected by zoonotic disease are, according to the International Livestock Research Institute located in Kenya, those living in the poorest countries, dependent upon their small livestock holdings. Not only do they suffer disproportionately from zoonosis, but when they are sick, their ability to care for their livestock hangs on their health by a thread. In addition to human and animal morbidity and mortality, the economic impact of selected infectious disease outbreaks has been enormous. Relations early on, we could perhaps intervene to prevent or mitigate the spread of those viruses to our domestic livestock. And if we could identify them in our livestock, we could potentially intervene or mitigate their spread to human populations. In this regard, the arrival of West Nile virus in the United States in 1999 was a watershed event. It killed thousands of crows in urban and suburban areas, but federal health authorities refused to consider that there might be a link between deaths of crows and the deaths of people from encephalitis in and around New York City. Originally identified as St. Louis encephalitis virus by public health authorities, it took Dr. Tracy McNamara, a veterinarian working at the Bronx Zoo, to point out that emus, which are highly susceptible to St. Louis encephalitis, were not sick, and therefore the virus causing the deaths of crows and people could not be St. Louis encephalitis. We now know that the reason that these pathogens, viruses in particular, emerge has everything to do with human activity: encroachment on areas that support biodiversity of wildlife, exploitation of natural resources, translocation of wildlife from one place to another, the role of human populations in the warming of the atmosphere and the oceans, our movements from place to place that carry pathogens or their vectors, and finally the ecological pressure that is raised when wildlife populations are forced into smaller and smaller islands surrounded by oceans of human activity. Of all viruses estimated to reside in wildlife, we have identified less than 1% to date. Sadly, the countries that suffer the most from emerging infectious diseases are also those where surveillance for those diseases is the weakest. All of this is to say that there is an enormous role for veterinarians to play in solving the wicked challenges that currently challenge the earth and its inhabitants. But we have much work to do to make One Health the default way of doing things. Having discussed the importance of One Health, we should now look carefully at what One Health is. It's a concept. The health and well-being of Earth's inhabitants are dependent upon the integrity of ecosystems. One Health is also an approach, that is, health professionals and social scientists working together to investigate complex challenges and devise solutions to those challenges using the best available knowledge. And while One Health is best understood in the context of emerging infectious diseases, the scope of One Health is much broader and includes any health challenge that affects humans and animals and includes an environmental component, whether that is natural or built. Here are 3 examples of what I consider to be true One Health approaches. The combined delivery of vaccination services by ministries of health and ministries of agriculture to animals, women, and children in nomadic pastoralist communities in Chad, providing wildlife tunnels and bridges either under or over roadways to save the lives of people and animals, and finally passing legislation that requires local and national disaster planning to include livestock and companion animals as well as people. It seems intuitive, but the barriers to making One Health the default way of doing things are considerable. Among the most important of these are the short-term political horizons of people who are elected to office, the lack of consensus in most countries about what is to be valued, the plethora of laws that often conflict among agencies with different priorities, and infrastructure silos that restrain and constrain our way of thinking and working. The One Health Commission is an international nonprofit organization that was established in 2008 by agreement between the American Medical Association and the American Veterinary Medical Association. It now exists independently of those 2 organizations. The mission of the One Health Commission is trifold: to connect, educate, and create. Several years ago, the Commission recognized the need to include students in veterinary and human medicine and environmental health among its board members. This arrangement has now evolved to a semi-independent International Students for One Health, which received some support from the Commission. Elections for its inaugural executive committee were held recently, and here are the individuals who were elected to serve. The Commission has identified the education of children in K-12 as one of its strategic priorities. Many children in the world will not complete primary or secondary school, and of those who do, many will not go on to higher education. To be successful, One Health must become second nature as well to members of the public. The Commission has also stood up a number of action teams which you are all invited to join. The Bat Rabies Educational Team worked together with Global Alliance for Rabies Control and Bat Conservation International to produce a poster for schools and health departments that warn children of the danger bats pose for rabies. The One Health and Social Sciences team is producing a commentary on the need to include individuals with expertise in the social sciences alongside health professionals to address One Health challenges. The One Health Ecology and Environmental team has just formed but has already identified 6 areas that its members plan to address. This past year alone, the Commission has provided comments on the Dublin Charter for One Health, a document produced by the Interaction Council, a group of 40 former World Health leaders, at its 34th plenary session, working with Chatham House Center for Global Health Security to identify and assess One Health networks and identify gaps in those networks, working with the Network for the Evaluation of One Health to develop metrics and a methodology to measure the One Healthness of initiatives, and convening groups such as the One Health Commission, the One Health Platform, the One Health Initiative, EcoHealth Alliance, the Planetary Health Alliance, and others to identify shared interests and goals. The Commission's website has experienced a tremendous increase in traffic since it was first created in 2013. The number of unique visits in a 6-month period now number more than 120,000, and page views are 3 times that many, and both of these have increased approximately 300% in the past 4 years. And finally, the reason we come here together today is that the One Health Commission, along with the One Health Initiative and the One Health Platform, established One Health Day in 2016. Today we celebrate the 2nd annual One Health Day. This map illustrates the number of events that were registered for One Health Day in 2016. It does not include all of the One Health Day events that occurred. I'd like to challenge you all to consider how we might support international development and mitigate the emergence of infectious diseases by advocating for and implementing a systems approach to One Health challenges. Can we take funding out of the realm of individual disease silos and put it towards One Health initiatives that require those funds be spent more broadly? In 2015, Tony Goldberg and Jonathan Patz referenced Aldo Leopold's land ethic in a commentary that asked if the interdependency of health of all Earth's inhabitants should be the basis for a global health ethic. We all need to decide whether we are at the center of the Earth, its highest accomplishment, or whether we are only one of several 100 million inhabitants of that planet. For too long we have acted as though the Earth and other species are here to serve us, when we perhaps should be considering how we can better respect and serve them. Our survival depends on which path we choose. Albert Schweitzer, physician, humanitarian, and philosopher, said it best in his treatise on the reverence for life, an idea that came to him as he watched a mother hippo and her baby exit a river in the Gabon in Africa. I can think of no better way to express our responsibility as veterinarians to care for the people and animals that inhabit this earth with us. Thank you.